Right, well, the World Health Organization is today launching the COVID-19 Technology Access Pool. The initiative is aimed at making health tools to fight COVID-19 accessible to all. We take you live on those proceedings in Geneva, Switzerland.
And I wish you all the very best in your deliberations.
Prime Minister Motley, many thanks indeed for that statement of support for this initiative. Fairness and equitable access is clearly the key buzzwords as we continue through this discussion. I'm going to move now to speak to Axel Jacobsen, who is the State Secretary in the Foreign Affairs Ministry in Norway. Mr. Jacobsen, I believe you are on the line, and if you are, then make sure you're unmuted and please go ahead with your statement.
Thank you, Hannah. Can you hear me?
We can hear you loud and clear, yes. The wonders of technology. Go ahead, sir.
Thank you. President Alvarado, Director General Dr. Tedros, colleagues, I'm honored on behalf of my country, Norway, to co-sponsor the Solidarity Call to Action, to establish a platform for open, collaborative sharing of knowledge, data, and intellectual property on existing and new health tools to combat COVID-19. As I speak, the official counts have passed 360,000 deaths globally from COVID-19, and the true figure is likely to be substantially higher. The pandemic represents a tragedy for its victims and their families, and economic hardships for hundreds of millions around the globe. If there's one thing this pandemic has reminded us, it is that challenges that are global can only be faced efficiently if we act together in a coordinated and global manner. It has also reminded us how vulnerable we are when we are confronted with a new virus without efficient tools to fight it. It is now of paramount importance that the world's best researchers and developers join forces in an unprecedented manner to provide us with these tools. Again, global challenges needs global solutions. I'm convinced that the only way to succeed is to collaborate and share knowledge and technologies to have the necessary tools as soon as possible. Once we have effective medicines and vaccines, they should be distributed in a fair and equitable way, according to public health criteria. This is the only way to curb the acute pandemic in the most efficient manner. The World Health Organization plays a vital role in facilitating the necessary sharing of knowledge. Rest assured that Norway stands firmly behind you in these efforts. Thank you again, President Alvarado, for raising this issue and for bringing us together today. Thank you very much.
Axel Jacobsen, thank you very much indeed. We are now going to move on and speak to Her Excellency Ambassador Monique van Dalen from the Netherlands. The ambassador is the representative of the Netherlands to the United Nations in Geneva. I believe you are on the line. I think I saw you earlier. So, Ambassador, you have the floor.
Yes. Okay. Thank you very much, Mr. President, Madam Prime Minister, Director General. The Netherlands supports the need for international cooperation and solidarity in combating COVID-19. The sharing of knowledge, intellectual property and data can play an important role in the development of vaccines or treatments that are affordable and accessible to all people in the world. This is especially true for knowledge that is created with public funding. The sharing must, in order to be effective, have a voluntary basis. We acknowledge that we need industry as a valuable partner. Their capacity to innovate, their expertise in development, production and distribution of vaccines and treatments, and their willingness to take risks must be valued alongside international cooperation, public investments and the sharing of knowledge. The main goal that we all want to achieve is a vaccine or treatment that is affordable and accessible to us all. In an innovation model based on the pooling of knowledge is, next to possible alternative models, a valuable instrument to pursue this aim. We thank Costa Rica and the WHO for their leadership and look forward to continuing to work together in fighting this public health crisis. Thank you very much.
Thank you very much, Ambassador. We now move to Her Excellency Ambassador Maria Ferrani, who is the permanent representative of Brazil to the United Nations in Geneva. Ambassador Ferrani, if you can hear me clearly, then please do unmute yourself and you have the floor.
Okay. Director General, President Carlos Alvarado of Costa Rica, Excellencies, colleagues, ladies and gentlemen. I'm not sure. You listen to me. Are you listening to me? Yes? Okay, so I'll start again. You have to listen again. Director General, President Carlos Alvarado of Costa Rica, Excellencies, colleagues, ladies and gentlemen, Brazil is honored to support this solidarity call to action and to participate in this launch event. We thank President Alvarado for his pioneering proposal and relentless work to bring all relevant partners together at this point. Access to quality, safe, efficient and affordable health technology remains a top priority for Brazil, all the more so in the context of this pandemic. Access to affordable medicines is key to build and strengthen sustainable and resilient health systems, to achieve universal health coverage and to respond to health emergencies. In the case of COVID-19, universal and equitable access to life-saving technologies is the only way to ensure that everyone, everywhere, will be safe and able to return to normalcy. Brazil is gratified to see that the global strategy and plan of action on public health, innovation, and intellectual property is one of the references for the call to action. Together with many partners, Brazil has led efforts to have this global strategy fully implemented to the benefit of all. We are confident that the call to action will be a major achievement in the public health worldwide, helping us all to rise up to the challenge posed by COVID-19. Thank you very much.
Ambassador, thank you very much indeed. We now take you over to Portugal. Dr. Rui Ivo is the president of the National Medicines Authority in Portugal and joins us live as well. Dr. Ivo, you have the floor.
Hello. You can hear me?
We can hear you very clearly. Yes, go ahead, please, sir.
Thank you very much. President Carlos Alvarado of Costa Rica, Excellency, Director General of WHO, Dr. Tedros Ghebreyesus, distinguished participants from other states and institutions, representatives from academia, international partners, industry, civil society. It is with great pleasure that I send you warm greetings from Portugal and add our voice to the call to action proposed by Costa Rica and supported by the World Health Organization. A call that aims at ensuring equitable access to health technologies through sharing of knowledge and data indispensable to the diagnosis, prevention, treatment and response to the pandemic outbreak of COVID-19. This initiative calls for a global priority in equitable access to health products and refers us to the importance of ensuring the principles of sustainability, availability and accessibility of safe, effective and quality health products, which more than ever are fundamental to tackling the current pandemic. It also stresses the need to guarantee the production, supply chain and equitable distribution of essential health products to our fellow citizens. Finally, considering the potentially devastating economic and social repercussions for health, particularly for developing countries, this section also calls for effective international cooperation in order to strengthen our health systems for this and future pandemics. Knowing that we all share these values, Portugal joins this call to action and its commitment to the collective success in combating COVID-19. Thank you very much for your attention.
Dr. Ivo, thank you very much. We do now have a representative from South Africa. Now we have the Health Minister, the Honourable Minister, Dr. Zwelini Mkhize, who is on the line for us. Dr. Mkhize, please, your supporting statement for this initiative.
Very much, Excellencies, from South Africa, on behalf of President Ramaphosa, I take this opportunity to congratulate the Director General of the World Health Organization, Dr. Tedros, and the President of the Republic of Costa Rica, His Excellency Mr. Carlos Alvaro Quesada, for launching this important initiative. We also appreciate the cross-regional efforts to realize equitable global access to COVID-19 health technologies as a critical response measure, as now more than ever the world needs this solidarity and cooperation to pool knowledge, intellectual property, and data for existing and new diagnostics, therapeutics, vaccines, and for the detection, prevention, and treatment of COVID-19. The solidarity call to action calls on key stakeholders and the global community to commit to undertaking actions which are urgently needed to advance the sharing of knowledge, intellectual property, and data that will benefit all humanity. It is also an important complement to the ACT Accelerator, which was launched a few weeks ago, which aims at making diagnostics, therapeutics, and vaccines for COVID-19 accessible on the basis of need worldwide. We'd also like to emphasize the importance of governments and international partners uniting around a global guarantee that ensures that when a safe and effective vaccine is developed, it is produced rapidly, at scale, and made available to all the people in all countries free of charge. We therefore call upon member states and the international community to support the solidarity call to action to promote health and to ensure the achievement of universal health coverage globally. Thank you very much.
Honourable Minister, many thanks indeed. As those who have been watching so far with this launch, the launch of this initiative, you will have noticed, and we've just had a series of supporting statements, and now we're going to move on to the next part, which is the moderated discussion. So we have a whole array of panellists who are going to be joining us. They're experts, they're industry experts, civil society representatives, members from academia as well. First of all, I would like to welcome to the discussion Professor Mariano Mazzucato, who is a professor in economics of innovation and public value at the University College London. Professor, I believe you're on the line, and I'm just hoping that your video is on and your audio as well. And my first question to you really is, we're talking about a pool of technology. Why do we need this patent pool right now in the middle of this pandemic? Why is it necessary? There we go. Good. It said that the host wouldn't unmute me. Well, it's absolutely necessary because there's no other choice. I mean, really, from the policy perspective, because this is in fact a policy proposal, we need to frame it as actively shaping and creating this market in the way that needs to be governed to satisfy the mission, which is a vaccine that is globally accessible for free around the world. And that really means making sure that we govern the process from the intellectual property, which of course this common pool is focusing on, the pricing, the manufacturing capability, the international collaboration and solidarity instead of competition between countries. But to do that, it really means also thinking through, what does it mean when countries globally have been putting in billions really into the health innovation market, and then unfortunately, unlike the military, when they spend money on areas that they need, they then govern the process to make sure they win the war. Even though I don't like the war narrative, it does actually mean governing this process in such a way that the pricing, the IPR, the licensing, is done in such a way to really foster what the 21st century is about, which is collective intelligence. Okay, Mariano, that's really interesting. And I want to bring in a fellow economist now. Professor Joseph Stiglitz is a professor at Columbia University. Professor, I'm wondering whether you agree with that, whether you think this type of technology access pool is necessary for the distribution of health technologies whenever we come up with them.
Absolutely. Intellectual property is a social construction that is designed to promote innovation. But in this particular case, the government is taking the the key role in financing the research. And having those ideas, the most important input into any research is other ideas. And that's why this pool of ideas is absolutely essential if there's going to be the fastest innovation possible. And speed is extraordinarily important in dealing with this pandemic. The longer it lasts, the more people die, but the worse the devastation for the economy. So it's actually important in this case, especially, that there be this kind of patent pool, that this knowledge be used quickly for the benefit of everybody in our global community.
I'm going to try and connect now with Dr. Jacques Dubochet. I'm hoping that he's on the line as well. Dr. Jacques Dubochet is a Swiss scientist. He's also a Nobel laureate. Sir, I can see you. Wonderful. I know that you've advocated for open science. I'm wondering if you can just explain to all of us what exactly you mean by that and the role that you think that science should play going forward with this initiative.
Oui, vous voyez le...
Thank you. COVID-19 is a very interesting example of a shared problem. It's a problem for all of us. It doesn't discriminate. And as long as we have one person sick with COVID-19 anywhere in the world, we're all potentially going to be sick with COVID-19, because as long as you have a patient somewhere, then the virus has an opportunity to come back. So it's a shared problem. However, if you have a shared problem, you need shared tools to tackle it. And the shared tools we have is the knowledge that everybody is acquiring very quickly as we go through this pandemic, and which we hope one day will help us to take better care of patients and cure them. That's why we need any treatments, vaccines, technologies to be a common good, and that is the basic aim of this initiative. This is an extraordinary undertaking, a very positive undertaking, a visible one that all of us need. And it might help us to overcome some of our other common problems and turn those into common good as well. I'm thinking particularly about the quality of life, which is deteriorating worldwide, and the climate change. We'll get out of the pandemic, and we are on the way to getting out of it as a result of our cooperation and collaboration now.
Boa sorte a todos nós.
Dr. Dubochet, many thanks. Who is the ad interim executive director at UNITAID. Mr. Duneton, if you can hear me, I hope you can. UNITAID is a huge WHO partner and very much involved in this particular initiative. Can you just describe for those watching in the media, the public as well, what exactly UNITAID's role will be with rolling out this type of pool?
Hello, good afternoon and good morning for everybody. I hope you can hear me. So it's quite important as an initiative and call for action. UNITAID is fully involved in the development of therapeutic and diagnostic under the ACT call for action, and we are working closely with partners, but also with WHO, of course. And finding the right medicines, the right diagnostic and the right vaccine is not sufficient. As it was said, it's quite important to make sure that it can be affordable everywhere at a low price. As UNITAID, we have a lot of experience in making the connection between the innovation and, of course, the scale-up. And we have created 10 years ago now the medicine patent pool that is coping with of course, the industry to make affordable medicine for HIV and, of course, hepatitis C. It is a great success because now, as I speak, we have a million of people who can benefit from the latest innovation to fight HIV. And I think that this initiative today is very important also to make sure that we will have equitable access for the new vaccine, for the treatment that we need to fight COVID-19.
Thank you. Let's bring in Greg Alton. Greg is a former Chief Patents Officer for Gilead. Greg, if you can hear me, and I hope you can, we're obviously talking about patents now and intellectual property. I'm wondering, and I'm sure many other people watching this will be wondering as well, with all good intentions aside, what will it take to get companies on board to share their intellectual property and their knowledge?
Great. I think I'm on mute. Is that?
Yes, you are. Yeah.
Okay, great. So first, let me just hold on. I got something weird on my screen here. Let me just start with, I think that, and Dr. Tedros said this initially, I'm a big supporter of intellectual property and the role that the industry's played in bringing medicine forward. However, with some things, I think that, the reason I'm very supportive of this call to action. First of all, in terms of fair and equitable access, I do think it would be fantastic to see the industry come forward and commit to working with the medicines patent pool or other mechanisms to make the intellectual property that comes out of the products that we develop, whether they're vaccines, therapeutics, or diagnostics, to be produced by generic manufacturers and then made available in fair and equitable terms globally. I do think to make this happen, we have to expect and respect that different companies will have different concerns that they're going to have to be addressed around whether, if this is truly voluntary, geographies around different tierings of geographies, understanding that the poorest countries of the world, what's fair and equitable for them will differ from middle income countries, that will differ from wealthy countries. That's the way the industry is going to look at this. I think they're going to look at protection around their commercial interests, their indications, their uses. But I do think this can be done. We've seen this done. We did in HIV, we've done this in hepatitis. I do think it's a good model, and I think I would love to see the industry come forward today while these products are being developed and make a commitment to make these products available for generic production, for local production, and get to what those terms are that will be acceptable. And it's going to vary from country to country. The other thing I just want to touch on why I'm very excited about this call to action is we don't have these products yet. We do not have the therapeutics. We do not have the vaccines. We do not have the diagnostics we need. I do also believe that the component of pooling knowledge, pooling data, creating a forum where this data can be shared to create those new breakthrough products is more important today, given this epidemic, than we've ever seen before. The human and economic costs. We cannot wait for the typical development timeline of a vaccine or a therapeutic. And I think this is an opportunity to see if this pooling of knowledge, sharing of information, sharing of intellectual property, of breaking down these barriers can expedite that development and allow these breakthroughs to come through. And if this works in COVID-19 or in this particular epidemic, maybe then this model could be used for some of the neglected diseases around the world that the current IP and industry model doesn't work well for.
Greg, thank you. I wonder if I can just bring back Professor Joseph Stiglitz to comment on that, really. I'm wondering whether, Professor, you think that we can perhaps use this concept of a patent pool as an opportunity to prepare for future crises as well.
Well, very much so. And what I wanted to emphasize are a couple points. One, the production of knowledge, as I said before, the most important ingredient is other knowledge. And when speed is important, as it is in this pandemic, you want that knowledge to be shared very quickly. What's interesting is that talking to my friends who are in the research community, that is happening at the individual level. But the question is, will the corporate level, will the institutional level buy into this? And what I find so exciting is the commitments being made all over the world in support of this. There's a second aspect that I want to highlight, which is we're going to need billions of doses of whatever medicines are going to be produced. That means it's really important to scale up at a low price. And the point, as long as this disease is going on in any part of the world, we're all going to be vulnerable. So it's really important in the interest of all of us that the prices be low. And that's not going to be achieved through monopoly pricing of the drug companies. It's only going to be true if we make sure that there's access to generics, to local producers, the widest dispersion of production. Now, there has to be return to those who are making their research, although much of the money is coming from the government. We should be clear about that. It's been de-risked. But we can do that through royalties, through charging for appropriate prices. That can be done within the patent pool. But what is really important here is the prioritization of speed and price accessibility. And that's really the idea behind this initiative, which I really commend you for.
And Mariana Mazzucato, I believe you want to come in on this.
Yes, I mean, I really think this is going to be the moment to make sure that we walk the talk of what kind of public-private collaborations should be in a space like this. And I don't think hepatitis C is a good example, with all due respect, Mr. Alton. This is actually the area where so many have written about, an area which received billions from, for example, the National Institutes of Health, 10 years of research, and then ultimately was marketed for $84,000 for a 12-week course, 1 pill a day. Now, that whole issue of how can we actually produce, again, as I was saying before, along the whole value chain, so governing the patent system, as we're talking about today, but also the pricing system that really reflects that collective effort that we're making in so many different parts of the health industry. This is a problem that goes beyond vaccines. Why this initiative is so important is we cannot risk getting it wrong. We have to today use this almost as a sandbox that hopefully will also create lessons for other parts of the sector. And in terms of what Joseph Stiglitz was saying, of course patents are important. They have simply been massively abused. They are too upstream. We today are patenting the tools for research. They're way too strong, hard to license. They're too wide. They're used for strategic reasons. So again, using this moment to also think much more broadly, how can we make patents do what they were meant to do in the beginning instead of really just fueling a lot of rents and monopoly power?
All right, that's the COVID-19 Technology Access Pool launch by the WHO happening now in Geneva, Switzerland. Thank you very much for tuning into SA Today here on SABC News. It's back to Auckland Park, though, now for the full view. From us here in Nasrec in the south of Johannesburg, it's cheerio and have yourself a lovely weekend. Take care. Cheers.